Welcome back to the Deep Dive. Today we are popping the hood on the body's heaviest internal organ. We are talking about the liver. And to guide us, we're pulling our insights from data provided by Blood Test UK. But we aren't just going to read a medical leaflet here. We want to understand why liver health is, well, kind of like the engine management light for your whole body. And we're going to look specifically at how easy this is to check if you happen to live somewhere like Milton Keynes.
Yeah, it's a great topic. The liver is, it's honestly misunderstood. People just think of it as a filter, like a lint trap or something. But it's so much more. It's really a chemical processing plant. It handles everything. Our mission today is to see why checking on that plant is such a smart move. And, looking at the info from Blood Test UK, it's actually incredibly easy to do.
Okay, so let's get into the mechanics of it, because the liver is famously a silent organ, isn't it?
It is.
It doesn't really complain or cause pain until the damage is already pretty severe. So when we talk about a liver blood test, we're not waiting for symptoms. We're looking for data. What are we actually hunting for here?
You're exactly right about the silence. That's why we look for what are called markers. Specifically, the test that Blood Test UK talks about is looking at enzymes. Things with names like ALT, AST, and bilirubin.
And just be clear, these are things that shouldn't be floating around in your bloodstream, right?
Exactly. That is the key thing to understand. These enzymes, ALT and AST, they're like little workers. They're supposed to be inside your liver cells doing their jobs.
Okay.
So if a blood test finds them out your blood, that's a red flag. It means the liver cells are damaged and those workers are leaking out.
So it's basically a structural integrity check. If the enzymes are outside the walls
are broken. That's the perfect analogy. And finding that leak early is how you can spot things like fatty liver or hepatitis before you even feel sick. Blood Test UK makes a massive point of this. Early detection changes everything. The liver can heal itself, but you have to give it a chance.
Which brings us to the logistics then, because it's one thing to know you should do it, but it's another to actually, get it done. This is where our case study of Milton Keynes comes in. If you're listening in MK, the data suggests you're in a bit of a sweet spot.
It really is a great model for how accessible this can be. In Milton Keynes, you aren't stuck waiting weeks and weeks for some complicated hospital referral. The network of local NHS clinics and private places is really dense. Blood Test UK points out that for people there, it's not a take a whole day off work situation.
Kind of more of a lunch break thing.
Precisely. It's designed to be fast. But there is one crucial bit of prep work you can't skip. And I think this sometimes trips people up. You have to fast.
Right, the dreaded fast, usually 8 to 12 hours.
Yeah.
But let's explain why, because I think people follow rules when they understand the reason.
Yeah, good point. It's all about accuracy. If you eat, say, a bacon sandwich an hour before your test, your blood sugar and fats will spike.
And that messes with the results.
It creates noise in the sample. It can cloud the results and give you a false reading on those liver markers. You want to see a clean baseline, not what you had for breakfast.
So you skip breakfast, you head to one of these clinics in Milton Keynes. What's the actual procedure? Is it some huge deal?
Hardly. It's a pit stop. You walk in, a nurse finds a vein, usually in your arm, and does a quick draw. It takes just a few minutes. And because the local clinics in Milton Keynes are using good modern tools, the turnaround is fast. You're in and out.
And then comes the part that actually matters, the results. Let's say the report comes back and those leaking enzymes are a bit high. Is it panic stations?
It's almost never panic time. It's pivot time. That's the beauty of this. If the numbers are off, a doctor can look at that and say, okay, we need to adjust your diet, or maybe cut back on alcohol, or let's get you moving more.
It gives you a roadmap.
Exactly. It just gives you peace of mind because you aren't guessing anymore. You know what's happening under the hood. And for our listeners in Milton Keynes, the local support network is very strong. You're not just handed a piece of paper and left alone. There's a whole community to help you.
So if we zoom out and look at the big picture here, what we're talking about is a really simple, low-effort, high-reward maintenance check. Blood Test UK has all the details. And for people in Milton Keynes, the path is basically paved and ready to go.
It really is. It's about shifting from reactive health, fixing things when they break, to proactive health, just keeping the machine running smoothly.
Which brings us to a final thought for you to chew on. We all dutifully take our cars for an MOT or service every year. We're terrified of breaking down on the M1.
We protect the engine in our car at all costs.
Exactly. But we often ignore the most complex, most important engine we will ever own, our own bodies. So the question isn't really, why should you take this test? It's more like, why are you treating your Ford Fiesta better than your own liver? Thanks for diving in with us.